Welcome back, everyone. Dr. Angie here. Today I want to talk to you about my initial experience with lupus. It was in the summer of 2004. I had just graduated from college and I was applying for medical school. It was a stressful time, and it was just getting the forms in and interviewing and trying to get things rolling. I had chickenpox that summer, which was a pretty mild case. Wasn't anything that I felt sick or had to stay in bed or anything like that. I was able to eat pretty well. I didn't have a fever. However, I had a few of those the rash on my chest, my arms, and also on my abdomen and in my legs, which went away gradually. I just had to treat the itchiness with calamine lotion, and after I'd isolated myself for my family for a while, I went to see a doctor, and they did a blood test, and it showed that I had antibodies. So it looked like, I'm immune to chickenpox. Then about a month or two afterwards, I noticed something strange happening to my skin. Initially, I saw that my toes were turning purple. They were a little bit painful and also swollen, tender. Whenever I would walk, it would feel a bit numb and just awkward to walk. And they were pretty sensitive. But that went away on its own. I had the doctor look at that, and he couldn't really give me a diagnosis. But at the same time, I was having some pain in my ear, and especially on the bone in the back of the ear. And he diagnosed me with mastoiditis and decided that, I guess get some antibiotics, and that cleared up. Then after that, things started to progress. I had itchy, swollen rashes that would appear on my earlobes. They would swell up a lot and get very tender, but they would just go away on their own. Maybe I would take antihistamine because I thought I was having some allergic reactions, so that would go away on their own. But then I noticed that I was having the rash, swelling, and redness appear over my eyebrows, on my eyelids, and then my lips. My lips were pretty bad. So I would have this swelling with some redness and feeling like there was some fluid under the skin, where it would just start in one part of the lip and just progress across the lip and just disappear. It would happen mostly to my upper lip, and this would come and go over weeks and months. Then I noticed initially I didn't have any problems with my energy. I know that a lot of people, when they have lupus, they end up initially in the hospital, and that's how they find out about the diagnosis, because they get right off the bat some kidney involvement, liver involvement, something with the brain or the heart. But I never had any of that, so I didn't even think of lupus in the beginning. And so kind of went on with my journey to get into medical school. So when I got into med school, and the work was intense because we were just overloaded with information right off the the first day of class. You're given so much information. It can be very overwhelming and very stressful. You have to learn a lot of things, a lot of new terms, which you think you can never remember, but over the years, you tend to remember a lot of things. So with all that information coming at me with that intensity and speed, I started feeling very stressed out. You know, we would have anatomy lab where we worked on cadavers, and I would be a bit sensitive to the formaldehyde, but I didn't really, you know, pay much attention to that. And I noticed that the swelling in my lips were getting really bad, where there was one time I really looked like I had eaten something that I was having a really bad reaction to. I went to see one of my professors, and he called in another associate. They looked at, you know, my lip, and, you know, they couldn't really give me a diagnosis because, you know, we couldn't do any blood testing at that time. But they just told me that if it keeps happening, to, you know, see a doctor. And, you know, I didn't really think it was that serious because, you know, the swelling and the rash, and, you know, they would just go away on their own. And so that's how I got through the first 2 years of med school. You know, I just felt like I didn't have time to be sick, and this was just probably some allergies. And so after the first 2 years of med school, we went on to our clinical rotations, and you know, clinical rotations can be very intense, especially the surgery rotations. You know, we had 24-hour calls. You know, you have to be in the hospital 24 hours on, 24 hours off, and you really can't sleep at nighttime because it was a trauma rotation, and you need to be alert. You know, even if you try to doze off, you're kind of half awake. And those took a toll on my energy. My energy started plummeting a lot with the long hours of clinical rotations. I had the rash coming on pretty strong. Then I started having that signature butterfly rash, where, you know, it would start with redness and swelling and just itchiness starting on one side of my face, and it would just kind of progress to the other side. And as it progressed, I would have, you know, what we call, you know, post-inflammatory hyperpigmentation, where it would turn really dark and it would look like I had a burn. And that would progress across my face, and it, you know, just, I realized that this was really not just an allergy. And, you know, I was learning more about diseases and symptoms and signs, and getting the education that made me realize that this is just more than allergy. So I asked some friends to look at it, and they said, oh, this could be lupus. And at that point, my energy was really low, where whenever I would get out of bed, it would take me a really long time to get out of bed. Whenever I would get up and take a shower, I had to sit for about 15 to 20 minutes to recover from a shower. I felt very depleted, very drained. And so I decided to go see my internal medicine doctor, and he, you know, did an exam, and he said, yeah, I suspect lupus. So he took a lot of blood and did a lot of blood testing, and the results came back. It was a, you know, no contest. My ANA was through the roof, and he told me that that was the worst case that he had ever seen. You know, I had waited 4 years to go see the doctor, so don't do that. Whenever you have these kind of symptoms, go see the doctor right away. I ignored my symptoms for 4 years. And so at that point, I was really scared that I had done some damage to my organs. And, you know, looking at the blood test, it didn't look like I had any major organ involvement, but I was very anemic, so my iron stores were very low, and my blood proteins were very high, and my white blood cell count was low, and there were so many other things that were all over the place. My lab work did not look good at all. The good thing also, though, was that I did not have a positive anti-double-stranded DNA antibody. So that was, you know, something good about the whole thing. I've never had a positive double-stranded DNA antibody. So usually when you have that, you tend to have more organ involvement and a whole host of other issues. So that could have been why, this illness just crept up on me. It was kind of really subtle for a long time. So anyway, the internal medicine doctor sent me to a rheumatologist, and he also did a lot of blood testing and gave me the official diagnosis of lupus. He asked me if I had any dry eyes or dry mouth or, just problems swallowing, and I didn't have any of those symptoms. However, my blood tests showed that I had antibodies, indicating Sjogren's syndrome. But because I didn't have any of the symptoms, he didn't pursue that. So he just gave me the diagnosis of lupus, told me to watch out for signs of brain involvement where you feel like you're losing your mind a bit, and they call that loopy. And he was talking about that, and he said, I have a risk of developing lymphoma. And however, he didn't tell me anything about diet. And at that time, I didn't know that it was important to look into what I was eating. And many times doctors are just going by what they've been trained. And I was in the medical school, and I was trained to look for symptoms and signs and just, give medication to treat illness. So I went along with that, and he just prescribed hydroxychloroquine for me, 200 milligrams twice a day. And so I started that, and within a month, I felt great. I felt like a new person. My energy was back where I, initially where I had been before. The rashes had gone away, the swelling and all the redness and discomfort went away. So I was feeling really good, and I thought, oh yeah, this is it. So I, even if I have lupus, this is great. I feel good. I'm not having any more symptoms. So carry on and, continue with your schooling. And I was actually able to function pretty well after that and finish medical school. He had me come back to see him a month after I'd started the medication, and did some more blood work and noticed that my blood tests were improving, and I was happy about that. So I just continued with the medication. I didn't change my diet at all, and I didn't change how I managed my stress in school. Just carried on with what I was doing because I felt pretty good. And so that was, my initial experience with, getting to know that I had lupus. And it was, it was traumatic. I would say it was traumatic, but I felt I couldn't dwell on, such a big diagnosis. I just felt like, okay, if I'm feeling good, I just have to keep on moving and keep on going with what I need to do and finish med school. I know, when you get a diagnosis like this, it's pretty difficult, and you feel like you can't deal with it. And you sometimes, in this day and age, people are actually looking for solutions, in addition to a medication. But back in 2008, I didn't know to even do that. And because of my medical training, I thought it was just medication, and that was pretty much it. I've learned over the years that I've needed to change what I'm eating, adjust a lot of things, and I've gotten into adding trying different kinds of alternative therapies, which have a lot of them worked. And so I'm going to be sharing more of that. And I hope you feel encouraged by my sharing my initial experience. And I'll be sharing more of this as we go along. So thank you very much for tuning in and watching, and I'll see you next time.